Hi, I'm Dr. Shivani. Welcome back to my channel where we simplify child health and mental well-being for everyday life. If you've clicked on this video, I'm guessing you must be worried about your child. My goal in this video is to help you recognize some of the key warning signs that may mean that your child needs to see a medical doctor in the emergency department. Let's start with the main signs to look out for. A fever that lasts for several days, a rash that does not fade away when you press on it, signs of increased work of breathing or respiratory distress in your child, signs of dehydration, a head injury after an unwitnessed fall or fall from a significant height, and lastly, possible seizures. We will now look into each of these signs in detail. The first sign that we'll talk about is a fever. Any temperature more than 38 degrees Celsius or 100.4 degrees Fahrenheit is considered to be truly a fever. The temperature for your child should be measured in their armpit with a cheap thermometer or a digital thermometer. Do not use the laser thermometers as they can be highly inaccurate. If you notice that your child has had a temperature more than 38 degrees Celsius or 100.4 degrees Fahrenheit every single day for 3 days, you can visit your local doctor or your general practitioner in your area. If the temperature more than 38 degrees has lasted every single day for more than 5 days, you need to seek urgent medical care. You'd have to present to your emergency department. If you notice that your child is having high-grade fevers, meaning temperatures more than 40 degrees, that's a significant fever and you should see your local doctor earlier just to make sure that there are no signs of bacterial infection. Lastly, if your child or your baby is less than 3 months of age, even a single temperature more than 38 degrees means that you should take your baby to the emergency department. Next, we will talk about rashes. Rashes are very common in babies. Most of these rashes are harmless. If you notice a rash on your baby, press on the rash and see if it fades away. If it fades away, it's one of the harmless rashes. If you notice a rash on your baby that when you press on it does not fade away, that can point to a serious illness and it means that you should seek urgent medical care. We'll now talk about difficulty breathing. If your child is struggling to breathe, it can be really scary to see. So I want you to remain calm and remember that most of these conditions are treatable. Look for signs that your child is struggling to breathe. Start with looking at your child's nose. If the nostrils are flaring up with every breath, that means that your child is struggling to breathe. If your child is bobbing their head back and forth with every breath, or shrugging their shoulders up and down with every breath, that can also be a sign that they're struggling to breathe. If you notice that your child is pulling in between their ribs and you can count their ribs on the side of the chest, that means that they're struggling to breathe. Look at your child's windpipe. If they're sucking in here with every single breath, that also means that could be a sign that they're struggling to breathe. Other signs can be that your child's breathing really fast, there's a color change around their lips, and it might seem a little bit more bluish or purplish than pinkish. Lastly, if your child is making noises with every breath, especially grunting noises with every single breath, that can mean that your child is having difficulty breathing. Ensure that your child is calm and is not crying while you're looking at these signs of increased work of breathing. Let's talk about dehydration. If your child is having a lot of episodes of vomiting or diarrhea, they are at risk of being dehydrated. When your child is sick, it's expected that your child is not going to eat a lot of solids, so that's okay, but they should be still drinking a lot of fluids. If your child is not drinking 50% of what they normally drink, or if the urine output is less than half of the normal urine output, then that means you need to take your child in to see a doctor. If your child is having multiple episodes of vomiting and you're trying to help them hydrate at home, make sure that you're mixing apple juice with water or you're giving them oral rehydration solution in the water. This is really important to help them maintain their sugar levels and regain the electrolytes that they have lost. Look for signs of extreme sleepiness, lethargy, dry lips or tongue, because these point towards signs of dehydration as well. Head injuries are very common in children, especially as they begin to crawl and walk. Here are the signs that mean that the head injury could be significant enough for you to take your child to see a doctor in the emergency department. 1. Your child has had a fall from more than 1 meter high. 2. No one's witnessed the fall of the child. Then you need to make sure that you see a doctor. 3. Your child's having a lot of episodes of vomiting after the injury. 4. You notice that your child has had an episode where they have lost consciousness or that they've fainted right after their head injury. Lastly, if you notice that your child is extremely sleepy or they're not behaving like their usual self, that could be a sign you need to seek urgent medical care. Lastly, we'll talk about seizures. If your child is having a true seizure, they will not be responding to you or looking at you during the entire episode of the seizure. Their lips and tongue might change color. They might not be breathing regularly. They may have full body shakes or shakes in one part of the body. If you notice this, lie your child on the left side and call the emergency services. Sometimes a shiver can be confusing. If your child's cold or has a fever, can look like a seizure. In this case, take a video of the episode and present to your local medical services and make sure that it is not a seizure. Thank you for being here. It can be really scary when your child falls sick, but remember that most of these conditions are treatable and easily manageable. You're doing so well. If you found this video helpful, then subscribe to our channel and share it with someone that you think might need to watch this. Until next time, be kind to yourself.